Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today's topic is what you need to know about spinal cord stimulator implants. Well, what exactly is a spinal cord stimulator? It is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to those suffering from chronic pain. It can work well for those with either back, leg, neck, or arm pain. So it's not just for extremity pain. It's considered a last resort treatment as it does involve surgery. It's very expensive for insurance companies, and it doesn't fix the problem, but it does mask pain nicely. Who benefits from a spinal cord stimulator implant? Well, as mentioned, it's not a first-line treatment. It is a last resort. It doesn't fix the problem. It can mask pain very well. It's an excellent last resort option for those who have failed back or neck surgery syndrome, where more surgery is not indicated. They really don't have a lot of options to help with pain control, maybe medications and whatnot, but this can help dramatically. Those with postlaminectomy syndrome, individuals with RSD or CRPS, which is reflex sympathetic dystrophy and complex regional pain syndrome, those with neuropathy, either diabetic or peripheral, and there are emerging indications for those suffering from really bad abdominal, pelvic, or testicular pain. Well, what exactly can it do? It can actually take a person who has chronic pain, depression, inability to work, disability, and it can completely turn a person's life around. It has been shown to work well for back, neck, arm, or leg pain, and what it does is it provides tiny electrical impulses around the spinal cord, and it can alter the way that the brain perceives pain signals. It can replace the pain in a leg, for instance, with a tingling sensation that patients just get used to and it's not painful. So people do need to have a trial implant placed first, which is a low-risk procedure. And also, the spinal cord stimulator can dramatically decrease a person's need for narcotic medications. Well, prior to having the final implant placed, individuals do need to have a trial spinal cord stimulator implant. And basically what that involves is percutaneous placement, it's not a large incision at all, of two tiny leads that go around the spinal cord that then come through the soft tissue and are attached outside the skin to a programming device that's also a battery pack. The leads are placed under sedation. The patient is not put fully to sleep because the pain doctor needs to ask the person, okay, I've turned it on, I've programmed it, do you feel pain relief or the tingling in the area where you normally have pain? Okay, and then it's worn for 5 to 7 days after the procedure to see if it's going to work, and then it's just removed in the office. If a person gets over 50% pain relief, then typically insurance companies will approve the final implant as long as the individual passes a psychological evaluation. Well, how's the final implant placed? Well, that takes about an hour. It does consist of a large paddle lead, and I'll show you one of those in a second. It does have an incision and some bony removal because of the size of the paddle lead is significant. And then the leads coming off of the paddle are tunneled under the skin to the battery pack, which is placed in a subcutaneous area, either just above the buttock area or around the abdomen. And the reason is because you don't want a person to be sitting on it and putting pressure on that area. The latest ones have over 200 programming options. They're rechargeable through the skin. It used to be that once the battery ran out, it had to be surgically replaced. The latest ones actually don't lose coverage as a patient moves from a sitting to a standing position or laying down. They just have better technology. So that's been great. How well do they work? Well, there's been quite a few studies looking at these, and pretty much all of them have been favorable. One that was done by St. Jude showed an 84% improvement in a patient's quality of life. One out of neurosurgery in 2006 showed a 77% good to excellent pain relief for a lot of different conditions. A study of diabetic neuropathy patients showed that 85% were able to regain a lot of lost sensation, and over 3/4 experienced significant pain relief and decreased need for narcotics. There also has been a New England Journal of Medicine study looking at spinal cord stimulators for RSD. It showed that they work exceptionally well, 85% of the time, if started within 2 years of the diagnosis. What you can see here is how small these battery packs are now with the programmers. I mean, that's a quarter, and they're not much bigger than that, so it's incredible. They used to be about twice that size. And here you can see the large paddle that is now what's placed around the spinal cord. These are all diodes. There's a lot of them now because of all the programming options. Well, what are the risks? There are some substantial risks. They're not really life-threatening risks, but there's a lot of risks that go along with these, such as, minor infection, could be migration of the leads, some of which may end up needing a revision procedure. The device may stop working after a couple years. It may just not work well for a patient. There's sometimes some bleeding and a little bit of wound breakdown. These are usually not super significant to the point of needing like a hospitalization, or fatal type of thing. It's usually something semi-minor that may need a washout or a revision, but a lot of times it just needs maybe antibiotics. The top pain clinics in the greater Las Vegas area are Nevada Pain. They are a one-stop shop. They have board-certified pain management doctors, chiropractors, PT, acupuncture, spinal decompression therapy, the whole gamut that allows them to get over a 90% success rate with patients. They have over 50 insurances being accepted. The Patient's Choice Award has been won by the pain doctors 5 years in a row. The number to call for scheduling is 702-323-0553. And check us out on the web at painmanagementlasvegas.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.